everyone, this is Marika and I welcome you all to this new session of nursing management. As we started with the third unit, we have discussed about what is a hospital, we have discussed what are the several objectives of a hospital, and we've also discussed about the scope of hospital. In our last session, we discussed about the organization and functioning of the hospital, in which we have seen that a hospital has several departments working towards the same goal. Several departments in the hospital includes reception, inpatient department, outpatient department, and administrative department. These are the four different departments that we discussed in our previous session. In this session today, we are going to continue and see the organization and functioning of the hospital, wherein we are going to discuss about other departments that are present in the hospital who works together in order to provide a satisfactory care for the patients. As I said, we already discussed about the reception, about the inpatient department, the outpatient department, and administrative department. Now, we are going to discuss the most important department in the hospital, which is the nursing department. Obviously, when I say the term nursing department, we can understand that it is one of the most important department within the hospital, as nurses are the heart of healthcare. The nursing department will have trained nurses who have completed either GNM, post-BSc, BSc or MSc nursing. So nursing department is one of the most important department within the healthcare, and it includes trained nurses who have completed their diploma, their BSc or their master's degree. The trained nurses within the nursing department are the nurses who are registered with the Council of Nursing. We are already aware that nurses have council to be registered in. When we complete our degree, when we complete our studies, we are registered in the state where we study. For example, in Karnataka, we are registered in Karnataka Nursing Council. In the nursing department, we have trained nurses who are registered with the Council of the state as well as the National Council, which is the Indian Nursing Council. Within the hospital, in the nursing department, we may find several nurses, but those nurses are given a specific department or a specific ward to work in. In any hospital, the nurses are allotted with patients. The nurses are given a certain number of patients to look after. Now, who does this allotment of the patient to the nurses working in the ward? It is the nursing superintendent. So, we have nursing superintendent who will allot the patients within the hospital to the nurses. Certain number of patients is given to a particular nurse. There is a ratio between the nurse and the patient. So, let us now see the ratio of nurse-patient within the hospital. Every hospital is different. Every hospital has different capacity for the patient. The very first ratio that we are going to discuss is in a teaching hospital, nurse-patient ratio in a hospital where there is a teaching unit. Teaching unit is a unit in the hospital where medical professionals are trained in the hospital. If there is a hospital with a teaching unit, the nurse-patient ratio is 1:5. One nurse will be allotted with 5 different patients. The next one is the nurse-patient ratio for a non-teaching hospital. For a non-teaching hospital, one nurse will be allotted with 3 patients. In general ward, one nurse will take care of 6 different patients. For special wards like child health, burns, neurology, and surgery, 4 patients will be allotted to one nurse. For neonatal ICU, one nurse will be allotted with 2 patients, whereas for ICU, one nurse will be allotted for 1 patient. In the labor room, the nurse-patient ratio is 1:1. That means for one labor table, one nurse will be allotted. And finally, for casualty, there will be 3 nurses present within the casualty for 24 hours. I hope you've understood the nurse-patient ratio. Moving on, let us discuss about the function of Chief Nursing Officer. We have already discussed the hierarchy within the hospital administration. We are going to discuss about the functions of Chief Nursing Officer. First, let us understand who is the Chief Nursing Officer. The nursing superintendent is the Chief Nursing Officer for all the staffs working within the hospital. So when we discuss the administrative department, we have seen we have a Chief Medical Officer, and right below the Chief Medical Officer, staff nurses working within the hospital. As she is the chief nursing officer, it is her responsibility to plan, to coordinate, as well as to assign the task to all the nurses working within the hospital. The first responsibility of a chief nursing officer is planning, coordinating, controlling, as well as reporting to the chief medical officer and assigning the work according to the capabilities of the staff nurses. The Chief Nursing Officer follows the patient classification system, which helps her to recruit, assign, and allocate the required number of staff at the right time and at the right place. Proper patient classification system will help to enhance the nursing care that is being provided to the patient within the hospital. According to TNAI and INC, the nursing superintendent follows the hospital bed strength in order to allocate the nurses to the particular department or the ward. The very first one, as we have seen in the administrative department, is the chief nursing officer. So there will be one chief nursing officer for 500 beds, which means one nursing superintendent or the chief nursing officer looks after 500 beds. The next one under the chief nursing officer will be deputy nursing superintendent, and there will be one deputy nursing superintendent for 300 beds. The next one that we have is assistant nursing superintendent, and there will be one assistant nursing superintendent for 100 beds. And finally, we have ward sister in charge. One ward sister in charge will be in charge of 25 to 35 beds within the ward. Another major responsibility of the chief nursing officer is to give the job descriptions for each of the nursing staff. It is her work to also give a job description to each of the staffs within the hospital. She also mentions what they are supposed to do and also give them guidance and supervision during their probation period, and delegates the work to the staffs in order to ensure that there is a smooth functioning of the hospital. Another important function of the chief nursing officer or the nursing superintendent is reporting to the chief medical officer. Chief medical officer occupies the top position in the hospital administration, and therefore the chief nursing officer is supposed to report to the chief medical officer. She not only reports to the chief medical officer but also makes sure to see the cleanliness of the hospital, to supervise the work of the staff nurses, and conducts regular rounds in the hospital in order to check its functioning. Another important function of the chief nursing officer is to take attendance, to prepare the duty roster, and conduct the nursing rounds. The chief nursing officer is the person who recruits the required number of staff nurse in the hospital, and they are the ones who coordinate the work with the entire department. It is the responsibility of the chief nursing officer to recruit the number of nurses that is required in the hospital to run the hospital properly, and they also coordinate work with the department. Another important function of the chief nursing officer is to ensure that in-service and continuing education is provided to all the staff nurses so that they can enhance their knowledge. So we have already seen in the objectives of the hospital that in-service education and continuing education is one of the most important objectives of the hospital, as there are several technological advancements, as there are various advancements that happens within our profession. In order to keep up with those technological advancement and new information, the nurses within the hospital, the working staff, is to be provided with in-service and continuing education. Therefore, it is the function of the chief nursing officer to provide in-service education, continuing education to all the staffs in the hospital. Another important function of the chief nursing officer is to ensure that the code of ethics, the rules and regulations are followed by each of the nursing staffs within the hospital. So there is a certain code of ethics that a nurse is supposed to follow. There are certain rules, certain regulations that a nurse must follow. Those rules and regulations, those code of ethics, so it is the function of the chief nursing officer to make sure that those code of ethics and rules and regulations are followed by all the staffs within the hospital. The nursing superintendent or the chief nursing officer has the right to even terminate the nursing staff if they do not follow the rules and regulation or if they violate the rules and regulation. Another important function of the Chief Nursing Officer is to make sure that the all-round development of the nurses working in the hospital is taking place by encouraging them to attend in-service education, continuing education, as well as by encouraging them to be involved in certain research activities. That is all about the nursing department. I hope you've understood what we have discussed in today's session. In today's session, we have discussed about the most important wing in the hospital, which is nursing department, and we have seen how nursing department function and what are the various functions of the chief nursing officer. We should understand that we only discussed about the functions of the chief nursing officer in this section, whereas we have been discussing about the functions of nurses under each of the department, which includes the reception, the inpatient, the outpatient, the emergency, and the administrative department. We have seen that nurses plays a major role in all of the department and they are the most important part of the hospital. I hope you've understood what we have discussed in today's class, and I'll see you all in the next session. Thank you and have a great day ahead.